Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. My name is Khaled Hassan Ibrahim, MBBS, Milan University, Master of Human Anatomy, National University. Today we are going to talk about the head and neck region. First of all, we will start by the osteology of the skull and the cervical vertebrae. Then we will move to the neck triangles. Then we will discuss and we will talk about the face and muscles of the facial expression, and we will talk also about the scalp. Then we will move to talk about the cavities in the head and neck, nasal cavity, oral cavity, then pharynx and larynx. Then we will talk briefly about the eye and the ear. Firstly, we will start by the bones of the skull. This is the skull. This is the anterior view. This is the lateral view. This is the posterior view. This is the superior view of the skull, and in the inferior aspect we have the base of the skull. Regarding the bones of the skull, we can divide the skull into two regions: the bones of the neurocranium and the viscerocranium or facial skeleton. Again, we have the neurocranium and we have the bone of the face or facial or viscerocranium. In the bone located anteriorly, we have this bone. It's called the frontal bone. This is the frontal bone. This is the nasal bone. This is the maxillary or maxillary bone. This is the mandible. This is the zygomatic bone. This is the zygomatic bone, the right one and the left one. This is the orbital cavity, the right orbit. This is the left orbit, left orbital cavity. This is the nasal cavity. In the superior view of the skull, this is again the frontal bone. This is the frontal bone. This is the right parietal bone. This is the left parietal bone. Here in the lateral view we have this bone which is called the temporal bone. Again, this is the frontal bone. This is the right and left parietal bones. This is the right temporal bone, left temporal bone, and posteriorly we have the occipital bone. So we have single bones like frontal, occipital, and we have a paired bone like parietal bones and temporal bones. We have a lot of sutures that connect between the bones of the skull. For example, this one is called frontal or coronal suture. This is a coronal suture. And this is a large one, is a sagittal suture. This is a sagittal suture. And posteriorly we have this suture which is called the lambdoid suture. During development, we have the area, patient area. This area is called anterior fontanelle. Yeah, it's anterior fontanelle. Its other name is bregma, anterior fontanelle or bregma. Posteriorly, we have the posterior fontanelle. Its other name is lambda. Again, we have frontal suture, sagittal suture, lambdoid suture. We have lambda, posterior fontanelle. We have anterior fontanelle or bregma. Usually, the posterior fontanelle close as pairs. Anterior fontanelle can close after 18 months. Again, this is the frontal bone. This is also the frontal bone. Here we have the foramen or notch. It's called supraorbital foramen. And this area is called the glabella. Here we will find, as we mentioned previously, the bones of the orbital cavity. This is the nasal cavity. Inside the nasal cavity, we have this bone which form a part of the nasal septum. It's called the vomer. This is the vomer. Here we have nasal concha or nasal concha. We have superior, middle and inferior. The superior and middle is a part of the ethmoid bone, but the inferior nasal concha is a separate bone. This is a maxillary bone. This is called superior alveolar process. This is a mandibular bone. This is called inferior alveolar process. As we mentioned laterally, this is the zygomatic bone. This is the zygomatic arch. This is the zygomatic arch. This is zygomatic process of the frontal bone. Here we have this projection which called the mastoid process. The mastoid process, site of origin for sternocleidomastoid and other muscles, the head and neck and ligaments. This area, this is called the styloid process. And as we mentioned, this is the base of the skull. Again, this is the mastoid process. This is the styloid process. Those are the occipital condyles, site of articulation with the first cervical vertebra, which is atlas. This is occipital condyle. This large foramen is the foramen magnum. Posteriorly, we have a prominent area. Here is called external occipital protuberance or inion. This is posterior occipital protuberance, and we have lines superior and inferior nuchal lines. Here again in the base of the skull, this is the medial and lateral pterygoid plates of the bone, which called sphenoid bone. When we move to talk about the mandible or lower jaw, it has many parts. This part of the mandible is called condylar process, which is the site of articulation between the mandible and the temporal bone. This area is called the coronoid process. This large area is called the ramus of the mandible, and this thickest area is called the body of the mandible. Again, this is the coronoid process. This is the condylar process. This is called mandibular notch. This is the ramus of the mandible. This is the body of the mandible. Here we have symphysis mentai, and we have the chin region. This is inferior alveolar arch. Again, this is coronoid process. This is a condylar process. This is the notch, ramus and body. In the inner aspect, in the mandible, we have the line or muscle, mylohyoid line, and we have this foramen, mandibular foramen for inferior alveolar nerve. Below the mylohyoid line, we will find fossa, some mandibular fossa for some mandibular gland, and above this line, we will find the sublingual fossa for sublingual canal. Anteriorly, sometimes we can find foramen here. It's called mental foramen for mental nerve. Like in this skull, this is a mental foramen for mental nerve. As we mentioned, we can divide the skull into neurocranium superiorly and viscerocranium, or parts of the facial skeleton. This area is called the calvaria. And the highest area of the calvaria is called the vertex. Of the calvaria. This is the outer or superior view, and this is the inner view. We will find the depression for superior sagittal sinus and for meningeal vessels inside the calvaria. When we look to inside the skull, we will find the cranial fossae. We have small one called anterior cranial fossa, and we have this one which called the middle cranial fossa. We have this one which called the posterior cranial fossa. Again, this is the anterior cranial fossa, mainly for frontal lobe of the brain. This is the middle cranial fossa for temporal lobe of the brain, and this is the posterior cranial fossa for the cerebellum, in the central nervous system. Inside the skull, in the base of the skull, we have many foramen and we have many foramina. Each foramen for passage of vessels or nerve or other structure. For example, in the anterior cranial fossa, this area is called the cribriform plate. This area is called cribriform plate. Here we will find the olfactory foramens for olfactory nerve. And this projection is called the crista galli. The crista galli is the site of attachment of which called the falx cerebelli. Anteriorly, in this area, we will find the foramen cecum. So, in the anterior cranial fossa, we have cribriform plates and the foramina. For olfactory nerve, we have the crista galli, we have the foramen cecum. In the middle cranial fossa, this bone is called the sphenoid bone. It's found in the base of the skull. It looks like a butterfly. It has the lesser wing. This is a lesser wing of the sphenoid, and this is a greater wing of the sphenoid. This is a greater wing of sphenoid and the lesser wing of the sphenoid. In the lesser wing of the sphenoid, we will find this opening, which is optic canal. This is the optic canal. The optic canal which transmit the optic nerve and the ophthalmic artery. Optic nerve and ophthalmic artery. Superiorly, here we will find the superior orbital fissure. This is superior orbital fissure. This is superior orbital fissure, and this is the inferior orbital fissure. The superior orbital fissure transmits the oculomotor nerve, cranial nerve number 3, trochlear nerve, cranial nerve number 4, abducens nerve, ophthalmic artery, ophthalmic vein, and ophthalmic nerve branch from the trigeminal. Again, this is the optic canal, and this is superior orbital fissure, and this is the inferior orbital fissure. Again, in the anterior cranial fossa, in the middle cranial fossa, we have foramen called here foramen rotundum, foramen ovale, and foramen spinosum, ROS, from medial to lateral, ROS, foramen rotundum, foramen ovale, and foramen spinosum. The foramen rotundum for transmission of the maxillary branch of the trigeminal nerve, the foramen ovale for mandibular branch of the trigeminal nerve, and foramen spinosum for emissary veins. Again, here we have the foramen, which called the foramen lacerum. Foramen lacerum for internal carotid artery. Internal carotid artery. Again, in the middle cranial fossa, we have optic canal, superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum, and foramen lacerum. Foramen lacerum. This is posterior cranial fossa. This canal is internal acoustic meatus. This is internal acoustic meatus, the right one. This is the left one. This foramen, the large foramen, is the jugular foramen. Jugular foramen for cranial nerve number 9, glossopharyngeal, number 10, vagus, and number 11, accessory nerve. Accessory nerve. This foramen is the foramen magnum for medulla oblongata, for vertebral artery and part of the accessory nerve. Here we will find the hypoglossal canal, the hypoglossal canal for cranial nerve number 12, which is hypoglossal nerve. Hypoglossal nerve. When we look to the skull, inferiorly, base, as we mentioned, this is styloid process. This is a mastoid process. This foramen is called stylomastoid foramen for facial nerve. Stylomastoid foramen for facial nerve. This is the foramen magnum, and here we will find the opening for internal carotid artery. This is the palate, the hard palate. This is the sphenoid bone, medial and lateral pterygoid plates. Medial and lateral pterygoid plates. The cadaver. This is the base of the skull. This is the anterior cranial fossa. This is the crista galli and the cribriform palates for olfactory nerves. This is optic canal. This is a part of the optic nerve. This is the middle cranial fossa. Middle cranial fossa. Here we find the trigeminal cave. This is the posterior cranial fossa. This is called cerebellar fossa or cerebellum. And this is the foramen magnum. Again, in the posterior cranial fossa. This is the middle cranial fossa, and this is the anterior cranial fossa, anterior cranial fossa. This area is the scalp, the temporal fossa, the temporal fossa. The boundaries of the temporal fossa superiorly and posteriorly by temporal lines, superior and inferior temporal lines. Anteriorly by the frontal process of the zygomatic bone and the zygomatic process of the frontal process of the zygomatic bone. Inferiorly by zygomatic arch. Again, the boundaries of the temporal fossa is the temporal fossa superiorly and posteriorly by temporal lines, anteriorly by zygomatic process of the frontal bone and frontal process of the zygomatic bone, inferiorly by zygomatic arch. What are the contents of the temporal fossa? The contents are temporalis muscle, one of the muscles of the mastication, temporalis fascia, deep temporal vessels, nerve, and superficial temporal artery. Superficial temporal artery. In this model, we will see the temporalis muscle. This is the temporalis muscles, one of the muscles of the mastication, covered by temporalis fascia, and here you will find the superficial temporal artery, also one of the content of the temporal fossa. Below the temporal fossa, we will find in this area the infratemporal fossa. Here in this area, we will find the infratemporal fossa. The contents of the infratemporal fossa is a part of the temporalis muscle, medial and lateral pterygoid muscles, which originate from the medial pterygoid plates and lateral pterygoid plate respectively, are inserted in the mandible. Also, the masseter muscles, muscles of the mastication. Other contents of the infratemporal fossa, the maxillary artery and the branches of the maxillary artery, the mandibular nerve, also pterygopalatine ganglia. Again, this is the infratemporal fossa. This is the temporal fossa, and this is the infratemporal fossa. Contents of the infratemporal fossa are muscles of mastication, maxillary artery, and the branches of the maxillary artery. Also, the mandibular nerve. This joint is a TMJ joint. This is a TMJ joint formed by articulation of the condyle of the mandible with the mandibular fossa in the temporal part. This is the articular disc which subdivides the joint into superior part and inferior part. The type of this joint is the modified synovial hinge joint. The muscles that control or move this joint are the muscles of mastication. Temporalis superiorly, masseter inferiorly, medial and lateral pterygoid. All the muscles of the mastication are innervated by trigeminal nerve and originated during the development from the first pharyngeal arch. Again, this is the temporal fossa, and this is the infratemporal fossa. In this session, we will talk about the cervical vertebrae. The number of the cervical vertebrae, 7 in number. This is the first one, this is the second one, this is the third one, 4th, 5th, 6th, and 7th cervical vertebrae. We have a typical vertebrae and we have the atypical vertebrae. What are the typical and what are the atypical? The atypical vertebrae are the first one, atlas, the second one, axis, and the second one, the second cervical vertebrae. Let's look closely to the cervical or cervical vertebrae. This is the cervical vertebra. This is the body of the vertebra. This is the spinous process, which are usually projected posteriorly. This is the lamina of the vertebra, and this is the pedicle of the vertebra. This foramen is found in the cervical or other parts or types of the vertebrae. This is called transverse foramen because it's located in the transverse process or foramen transversarium. This foramen for passage of vertebral vessels, vertebral artery, vertebral vein. Usually, the artery passes through the all cervical vertebrae except C7, except the C7. Again, this is the body of the vertebra. This is a transverse process with the foramen transversarium. This is the pedicle. Sorry, this is the lamina. This is the pedicle, and this is spinous process. Usually, the spinous process of the cervical vertebra is pivot. Is a pivot. The shape of vertebral canal is triangular in shape. Triangular in shape. So this is a typical vertebra. Also, it has a body, transverse process, lamina, pedicle, pivot, spinous process. Also, this is the typical vertebra. This is typical vertebra. This is the atypical vertebra. This is the C1. This is C1. This is the C1 or atlas. It has the transverse processes, has the articulation site for occipital condyle to form occipital joint. This area for articulation with the dense or odontoid process of the second cervical vertebra. This is the anterior arch and this is the posterior arch. So no spinous process in the first cervical vertebra. Also no body in the cervical vertebra. Again, this is the anterior arch, this is the posterior arch, this is the transverse process, this is the site for articulation with the occipital condyle, this is the foramen transversarium, this is the inferior articular facet for articulation with the C2 or axis. This is the axis, this is the second vertebra. It has a very characteristic odontoid or dense. Odontoid or dense. Also, it contains foramen transversarium, vertebral canal, spinous process. The axis articulate with the atlas to form a atlanto-axial joint, which allow the rotational movement. There are many ligaments of the axis, the dense in each position. For example, transverse ligaments and alar ligament. Transverse ligaments and alar ligament. There is no any intervertebral disc between C1 and C2. Finally, this is the C7. It's the atypical cervical vertebra. It contains body, canal, foramen transversarium, which does not permit passage of the vertebral artery, pedicle, lamina, but it has the longest spinous process. Again, and also the spinous process of the C7 is not pivot. It's not pivot, so it is atypical cervical vertebra. In this session, we will talk about the neck triangles. This muscle is very important muscle and landmark in the neck region. This is sternocleidomastoid. This is sternocleidomastoid muscle. This muscle subdivides the neck into anterior and posterior triangles. Also, the posterior boundaries of the posterior triangle is anterior border of this muscle, which is the trapezius muscle. This is trapezius muscle. Sternocleidomastoid is a very important muscle. It has proximal attachment with the mastoid process and nuchal line, and distal attachment in the sternum and in the clavicle. So it's called sternocleidomastoid. The innervation of this muscle by accessory nerve, spinal part of the accessory nerve. Also, the trapezius innervated by accessory nerve. The action of this muscle, it extends the proximal vertebral joint and flex the distal vertebral joint, and it brings the chin to the manubrium. When it contracts unilaterally, it turns the face to the opposite side. This is the anterior, this is the sternocleidomastoid, so this is the anterior triangle. The anterior triangle is subdivided by the omohyoid. This is the omohyoid muscle, and this muscle here is a digastric muscle into this triangle is called the digastric triangle or submandibular triangle. Submandibular triangle or digastric triangle. Also by posterior belly of digastric and the homohyoid into, this is called vascular or carotid triangle. Again, anteriorly we have submandibular triangle, vascular triangle, and muscular triangle and submental triangle in the midline. So the anterior neck triangle is subdivided into 4 triangles: submental, which contains submental lymph nodes; submandibular, which contains the submandibular gland and submandibular lymph nodes. Its other name is the digastric triangle; vascular triangle or carotid triangle, which contains the carotid artery, jugular vein and vagus, the contents of the carotid sheath; and the muscular triangle, which contains the strap muscles, infrahyoid muscle. This bone, which located here, this is the hyoid bone. This is the hyoid bone. Again, this is the sternocleidomastoid, the posterior border of the sternocleidomastoid, and the anterior border of the trapezius muscle form the posterior triangle. The posterior triangle is subdivided by this muscle, inferior part of the homohyoid, into small subclavian or supraclavicular triangle and large occipital triangle. What are the contents of the subclavian triangle? Subclavian vessels. What are the contents of the posterior triangle? Accessory nerve, branches of the cervical plexus, lymph nodes, and other structure. Mainly, the most important structure of the posterior triangle is the accessory spinal nerve or spinal accessory nerve or the accessory nerve. Again, this is sternocleidomastoid. This is one of the strap muscles or infrahyoid muscle. We have one originate from the sternum and insert into the hyoid is called sternohyoid. One muscle from the sternum to the thyroid is called sternothyroid, and one muscle from the thyroid cartilage to the hyoid line is called thyrohyoid. All the strap muscles are innervated by ansa cervicalis except thyrohyoid, which is innervated by C1 with hypoglossal nerve. In this cadaver, we will talk firstly about the neck fascia. The neck fascia, we will start first the outer structure, the skin. After the skin, we have the superficial fascia, then deep fascia. In the superficial fascia, we have a lot of subcutaneous tissues, fats, and we have this muscle, which is the platysma. The platysma has a proximal attachment, the lower part of the mandible, and it has distal attachment over the clavicle and the upper part of the chest. The flat shaped muscle located in the anterior lateral aspect of the neck. Platysma is the one of the muscles of the facial expression, so it is innervated by facial nerve, specifically by the cervical branch of the facial nerve. When we remove the platysma and the other contents of the superficial fascia, we will find the deep fascia. The deep fascia of the neck, the first layer of the deep fascia, which is called the investing deep fascia. This is a part of the investing deep fascia. The investing deep fascia, the fascia that close all over the neck, all the necks, and mainly close the sternocleidomastoid, trapezius, and other muscles of the neck. Investing deep fascia, and we have the fascia around the thyroid and trachea. It's called pretracheal fascia, and we have fascia posterior is called prevertebral fascia, and sheaths which cover the carotid artery and jugular vein called the carotid sheaths. Again, the fascia of the neck are superficial fascia, skin, subcutaneous tissue, and platysma. Investing deep fascia, distal layer of the deep fascia which covers the neck. Pretracheal fascia cover the trachea and its contents and surrounding structures. prevertebral fascia posteriorly, and carotid sheath, which contains the internal jugular, common carotid and internal carotid, and the vagus nerve. The vagus nerve. Also, we have a lot of spaces in the neck, pretracheal space, retropharyngeal space, and other very important spaces. Regarding the neck triangles, we have this muscle, the very important muscle, the landmark, the sternocleidomastoid. This is sternocleidomastoid. This is the sternal head, and this is the clavicular head, and it's attached proximally to the mastoid process. This is sternocleidomastoid. As we mentioned previously, it's innervated by the accessory nerve, spinal part of the accessory nerve, and posteriorly you will find the trapezius muscle. This is the trapezius muscle, posterior, also innervated by the accessory nerve. The triangle posterior to the sternocleidomastoid is a posterior triangle, and anterior to it, anterior triangle and anterior triangles. This muscle is the omohyoid. This is the omohyoid. The omohyoid is subdivide the posterior triangle into this is small subclavian or supraclavicular triangle, and this one is the largest one is the occipital triangle. The contents of the occipital triangle, as we mentioned previously, are nerves. This is one of the branches of the cervical plexus, and this is a very important nerve, which is the accessory nerve. This is the accessory nerve. Accessory nerve, one of the most important structures in the posterior triangle. It innervates the sternocleidomastoid and innervates the trapezius muscle. In addition to nerves, we will find vessels and fats and lymph nodes. Anteriorly, this triangle is a muscular triangle. This area, this is a submental triangle. This area is submandibular triangle. Let's talk about the strap muscles. Strap muscles are the infrared muscle. We have one muscle, which this one originates from the sternum and inserted into the hyoid bone. It's called sternohyoid. This is sternohyoid. This is sternohyoid. This is the left one, and this is the right sternohyoid. Below the sternohyoid, we will find the sternothyroid. This is sternothyroid muscle, and we have one muscle from the thyroid cartilage to the hyoid point. It's called thyrohyoid. Also, we will find the omohyoid. This is the omohyoid. This is the superior part. This is the inferior part of the omohyoid. Omohyoid, sternohyoid, sternothyroid, thyrohyoid. It's called strap muscles. All of them are innervated by ansa cervicalis except the thyrohyoid. Thyrohyoid is innervated by C1 with hypoglossal nerve. C1 fibrous with hypoglossal nerve. This is thyroid gland. This is thyroid gland, one of the contents of the neck regions. This is the left lobe. Here we will find the isthmus. This is the right lobe. P is the sternothyroid, the large lobe of the thyroid gland. So the largest endocrine gland in the body. The blood supply of the endocrine of the thyroid gland by superior and inferior thyroid arteries. The venous drainage by superior, middle, and inferior thyroid veins. The main function of the thyroid gland is to produce the thyroxine, T4, T3, and calcitonin. It's regulated by hypothalamic pituitary axis. Regulated by hypothalamic pituitary axis. It's covered by capsule, as illustrated in this cadaver. Here we will find the submandibular triangle. This structure is submandibular gland. This is submandibular gland. This is part of the facial vessels. In this region we will find facial artery and facial vein. This is the facial vessels. The facial vessels is a part of the platysma. This is the other part of the platysma. Finally, in the carotid triangle, in the carotid sheath, we will find this structure, which is the internal jugular vein. This is the internal jugular vein, and this is the structure, which is the vagus nerve. This is the vagus nerve, cranial nerve number 10, and this structure is the common carotid artery. This structure is common carotid artery. The common carotid artery will bifurcate to give us the external and internal carotid artery. In this session, we will talk about the larynx. This is the larynx or voice box, extended superiorly from the hyoid bone. This is the hyoid bone. Inferiorly to this cartilage, which is the cricoid cartilage. The main function of the larynx is to produce the sound or voice production. Other function of the larynx, the pathway for air respiration. Also, it assists in swallowing. The larynx contains a lot of cartilages. For example, this large one is called the thyroid cartilage. The thyroid cartilage has the lamina, right and left lamina. It has superior horn and inferior horn. Thyroid notch, which give a prominent projection in male, which called the Adam's apples. Also, the cricoid cartilage at the level of the C6, the hyoid bone at the level of the C3, the cricoid cartilage, the ring singlet shape at the level of the C6. Also, we have this cartilage, the epiglottis cartilage, and we have arytenoid cartilages and cuneiform and corniculate cartilages. There are a lot of membranes. For example, between the thyroid and hyoid called thyrohyoid membrane. Medially, we have the medial thyrohyoid ligaments and we have the lateral ligaments. They are openings for laryngeal vessels and nerves. Between the thyroid cartilage and the cricoid cartilage, also there is cricothyroid membrane. Regarding the muscles of the larynx, we can divide the muscles of the larynx into external laryngeal muscles and internal laryngeal muscles, extrinsic and intrinsic. The extrinsic muscles are suprahyoid muscles and infrahyoid muscles or sternum muscles. Regarding the intrinsic muscles of the larynx, you have this muscle which called cricothyroid muscle. This is cricothyroid muscle. This muscle is the exception of innervation of the laryngeal muscle. This muscle is the only muscle in the larynx innervated by external laryngeal nerve. The other muscles of the pharynx, of the larynx, posterior, cricoarytenoid, transverse, and oblique, all these muscles are innervated by this nerve, which is recurrent laryngeal nerve. In this area, this is the laryngeal inlet. Superiorly, we will find the laryngeal fold, and inferiorly, we will find the vocal fold. The space between the two vocal folds called the rima glottis. The space between the two vestibular folds is called the rima vestibuli. Again, this is the epiglottis. This is the hyoid bone. Body, lesser horn, greater horn, thyrohyoid membrane, thyroid cartilage, cricoid cartilage, epiglottis, posterior cricoarytenoid muscle, transverse, oblique transverse muscles. All these muscles innervated by recurrent laryngeal nerve, except this muscle cricothyroid, which is innervated by external laryngeal nerve. This is the oral cavity. This is the nasal cavity. The nasal cavity is the lateral wall. The medial wall of the nasal cavity is formed by vomer, perpendicular plate of the ethmoid bone, and partly by the cartilage. This is the oral cavity, which contains the tongue, the muscular organ. The tongue has many muscles, extrinsic muscles and intrinsic muscles. Extrinsic muscles are styloglossus, genoglossus, palatoglossus muscle, and hyoglossus muscles. The extrinsic muscle of the tongue moves the tongue, protrudes the tongue, deviates the one into the right and the left. All the muscles of the tongue are innervated by hypoglossal nerve except the palatoglossus. One of the most important muscles in the tongue is the genioglossus tongue muscle, because it protrudes the tongue anteriorly. When this muscle is paralyzed or hyoglossus nerve is injured, it can cause lower airway obstruction. This specimen in the gray color is a sublingual gland. This for submandibular gland. Motor innervation. Also, the tongue contains intrinsic muscles. Longitudinal transfers alter the shape of the tongue. Regarding the sensation, we have which called sulcus terminalis posteriorly, which divides the tongue into anterior two cells and posterior one cell. The anterior two cells, general sensation by lingual nerve, special sensation by corda tympani branch from the facial nerve. The posterior one cell, general and special, both of them by glossopharyngeal nerve. Regarding the pharynx is the superior expanded part of the GI system. It has three parts: posterior to the nose called nasopharynx, posterior to the mouth is called oropharynx, and posterior to the larynx called hypopharynx. The pharynx contains a lot of muscles: superior, middle, inferior constrictors, and longitudinal muscles: stylopharyngeus, albingopharyngeus, and palatopharyngeus. All these muscles innervated by pharyngeal plexus except the stylopharyngeus, which is innervated by the prostopharyngeal nerve. In this session, we will talk about the muscles of the facial expression. Muscles of the facial expression are originated from the second pharyngeal arch, so they are innervated by the facial nerve, seventh cranial nerve. We can divide the muscles of the facial expression into three groups: muscles around the eye, muscles around the nose, and muscles around the mouth. One of the most important muscles in the facial expression is the orbicularis oculi. This is orbicularis oculi. It has three parts. This part is called ocular part. This part is called palpebral part. Also, it has lacrimal part. The origin of this muscle from the medial palpebral ligaments. The insertion also in the medial palpebral ligaments. Action of the orbicularis oculi, it closes the eye. The ocular part closes the eye tightly, and the palpebral part closes the eye gently. Also, we have muscle here, is called the corrugator supercilii. It's around the eye, corrugator supercilii. Also, it is innervated by facial nerve, orbicularis oculi by facial nerve. In the nose, we have the muscle that compress the nostrils called nasalis. Also, we have muscle called the dilator of the nose. Around the mouth, we have a lot of muscles. The main muscle around the mouth is orbicularis oris. This is orbicularis oris. In the angle of the mouth, we have the depressor called depressor anguli oris, and we have depressor libii inferioris. This muscle here in the chin or mental region is called the mentalis. Again, this is the orbicularis oris. This is depressor libii inferioris. This is depressor anguli oris, and we have also levator libii superioris, and we have which called levator libii superioris ala nasi, and we have levator anguli oris. Here we will find one of the zygomaticus muscle. We have zygomatic major and zygomaticus minor. This muscle is the masseter muscle. This gland here is the parotid gland. The parotid glands, one of the largest salivary glands, is located anterior to the ear and in the mandibular regions. It has a duct. This is called the parotid gland duct. The facial nerve enters the parotid glands and subdivides the parotid gland into the superficial and deep part, and it divided into 5 branches. The first one is called frontal zygomaticus, pectoral branch, marginal mandibular branch, and cervical branch. Any one of these branches innervate group of muscles. Again, the facial nerve subdivided into 5 branches: frontal, zygomaticus branch, pectoral branch, marginal mandibular, and cervical branch. The cervical branch innervate the platysma. Again, muscles of the facial expression: muscles around the eye, orbicularis oculi, corrugator; muscle around the nose, dilator and compressor, specifically nasalis; muscles around the mouth, orbicularis oculi, mentalis, depressor anguli, oris, depressor levi inferioris, and other muscles of the facial expression. Regarding the blood supply of the face, it's mainly by facial artery. This is a facial artery which is a branch from the external carotid artery. It gives a lot of branch: inferior labial artery, superior labial artery, angular artery. The main blood supply of the face from facial artery, with contribution from the superior ophthalmic artery, which is branched from the internal carotid artery. In this session, we will talk about the scalp. The scalp is the multi-layer that covers the calvaria of the scalp. This is the scalp. The scalp has many layers. The outer one, from the first letter in the scalp, the skin. S for skin. C for connective tissue. C for connective tissue. And A for aponeurosis, Gallia aponeurotica. L for loose connective tissue, and B for pericranium or epicranium. Again, the scalp is a multi-layer that cover the calvaria, extended anteriorly to the supraciliary arch, and posteriorly to the nuchal lines. The scalp has many layers. The outer one is the skin, S for skin, C for connective tissue, dense connective tissue, A for aponeurosis, L for loose connective tissue, and B for pericranium or periosteum of the skull. Pericranium, this is the pericranium of the skull. The main blood supply of the scalp is from superficial temporal artery, which is branched from the external carotid artery. This other contribution from the ophthalmic artery anteriorly and occipital artery posteriorly. Regarding the scalp contains skin of the scalp, thick, highly vascular, contain a lot of sebaceous glands and hair. Bleeding which occur in the scalp will result in profuse bleeding or huge amount of bleeding. But healing in the scalp will occur rapidly because it's highly vascular. The scalp layer, this is the third layer, which is aponeurosis. This is the aponeurosis or Gallia aponeurotica of occipitofrontalis muscle. This is the occipitofrontalis muscle. This is the frontal vein, and this is the occipital belly of the occipitofrontalis, and this is the Gallia aponeurotica, which is the third layer of the scalp. A aponeurosis. This artery is a superficial temporal artery. It has the anterior branch and the posterior branch. As we mentioned, is the main blood supply to the scalp. Venous drainage by mainly superficial temporal vein. This muscle, it produce action of this muscle, produce vertical or horizontal ridges in the frontal part or area. The innervation of the occipitofrontalis by branches from the facial nerve. Regarding the muscles of the facial expression, as we mentioned previously, we have the muscles around the eye, muscles around the nose, muscles around the mouth. This one is the orbicularis oculi, palpebral part, and ocular part. Here we will find the nasalis muscles. Here you will find the orbicularis oculi. Here the site for mentalis, depressor anguli, orbicularis oris, depressor anguli oris, and other muscles of the mouth. All the muscles of the facial expression are innervated by facial nerve. In the eye, this is the upper eyelid, and this is the lower eyelid with eyelashes. In the oral cavity or in the mouth, this is the upper lip, and this is the lower lip. This is the upper lip, and this is the lower lip. Regarding the oral cavity is subdivided into two regions. It has two parts. The area between the lips and gingiva and the gums is called the oral vestibules. The area behind the teeth is called the oral cavity proper. The oral cavity proper. Blood supply of the lips by superior and inferior labial arteries, which are branches from the facial artery. Facial artery. This is one of the upper teeth. Those are the lower teeth. The contents of the oral cavity, mainly the tongue, the muscular organ that help in speech and swallowing, also mastication and intestine. Other contents of the oral cavity are salivary glands, sublingual glands, and other glands. Regarding the ear, this is a part of the external ear. In the ear, we have three parts: external ear, middle ear, and the inner ear or labes. The external ear, we have the pinna or auricle. The pinna or auricle, we have the external auditory canal. In the pinna or auricle, we have the earlobe or ear lobules. In the ear lobules, we have the tragus and antitragus, helix and antihelix, helix and antihelix. The main function of the pinna or all ear follicles is to collect the sounds, From the pinna, the sounds will enter the external auditory canal, In this area, we will find the parotid gland, the largest salivary gland. Here we will find the parotid gland. This artery or this vessel, the superficial temporal vessel, and this muscle here, the temporalis muscle, which is one of the muscles of the mastication. Temporalis muscles, superficial temporal vessels, parotid glands, the pinna, and or the auricles. This is the ear, this is the external ear, this is the auricle or pinna, this is the external auditory canal. This is the external auditory canal. The external auditory canal has two parts, cartilaginous part, and the inner one is the bony part. The contents of the ear usually are located in the vitreous part of the temporal part. This is the external ear, and from the tympanic membrane, here we will find the middle ear. This is the middle ear, and here this is the inner ear or the larynx. The length of the auditory canal is about 2 to 3 centimeters. Contain many sebaceous glands or ceruminous glands, which produce the wax, the ear wax. It conducts the sounds which collected by the pinna toward the tympanic membrane. This is a tympanic membrane. The semi-transparent membrane has part, external part, and the inner part lined by mucous membrane. The ossicles of the middle ear are attached to the tympanic membrane. The middle ear has a tympanic cavity, portals, and the epitympanic recess. The cavity of the middle ear has an anterior part, posterior part, medial wall, and lateral wall. Again, floor, roof superiorly, floor inferiorly, medial wall, and lateral wall and posterior wall, which connected with the mastoid air cells. Regarding the inner ear is subdivided into bony labyrinth and membranous labyrinth. The bony labyrinth group of cavities, cavity for ochlea and for semicircular canals and for vestibules. Regarding the membranous labyrinth, this nerve is a vestibulocochlear nerve. This is the cochlea which is responsible for hearing. Those are the semicircular canals for equilibrium and balance, and also in the inner ear we will find the utricle and saccule. Those are the ossicles. This is stapes, this is the incus, and this is the malleolus. This is a malleolus which attached to the tympanic membrane. This is the incus which connect the malleolus to the stapes. This smallest one is the stapes. The stapes connected with the labyrinth or the inner ear. So the ear, the organ that responsible for hearing by the cochlea and equilibrium by semicircular canals and vestibules. Regarding the blood supply of the inner ear, is mainly from the labyrinthine artery. In the middle ear we have the connection with the nasopharynx by this tube or canal, which is Eustachian tube or Eustachian canal or pharyngeal-tympanic canal. Also it has the cartilaginous part and the bony part. Regarding the eye, this is the orbital cavity. The orbital cavity, as we mentioned previously, found in the anterior aspect of the skull. It has superior wall or roof, inferior wall or floor, medial wall and lateral wall. The thickest wall is the lateral wall. The medial wall is mainly formed by ethmoid bone, part of sphenoid and part of the lacrimal bone. The inferior is mainly by maxillary part, the lateral mainly by zygomatic bone, the superior or lobe mainly by frontal bone. The orbital cavity contains a lot of structures. For example, the eyeball, eye muscles, nerves, vessels, artery and veins, and fats. This is the orbital cavity. This is the optic canal. This is superior orbital fissure, and this is the inferior orbital fissure. This is the orbital cavity with the eye bone inside the orbital cavity. This is the muscles, the superior rectus muscle. This is the lateral rectus muscle. This is the inferior rectus muscle. Here we will find the medial rectus muscle. Also, we have very two important muscles. One of them located superiorly, the superior oblique muscle, and one of them located inferiorly, the inferior oblique muscles. Again, extraocular muscles are superior rectus, lateral rectus, inferior rectus, medial rectus, superior oblique, and inferior oblique. Also, we will find muscle located superior to the superior rectus, which is levator bulbibri superioris. All the eye muscles are innervated by oculomotor nerve except the lateral rectus. Lateral rectus is innervated by abducens nerve, cranial nerve number 6. The superior oblique is innervated by trochlear nerve, cranial nerve number 4. The movement that occurs at the eyeball are abduction, elevation, and depression and rotation. Regarding the layers of the eye, we have the outer one, which is called fibrous layer, then the sclera and the cornea. The middle one is called vascular layer, contains the choroids and other parts of the middle layer. The inner one is called the retinal layer. Again, the outer one fibrous, sclera. The middle one is choroid or usual part. The inner one contains the retina. Anteriorly, this is the cornea. Inside the cornea, we will find the pupil, the opening that located in the iris. The iris is a pigmented area in the eye. This is a cornea. This is the opening for pupil, and this is eyes, which is in gray color. In gray color. Other structures are located in the orbital cavity: optic nerve, oculomotor nerves, and branches from the oculomotor nerve, cerebral ganglia, which is located in the lateral aspect. Other structures are vessels, ophthalmic arteries, ophthalmic artery and branches from the ophthalmic artery, and also you will find a lot of fats located in the eye. Again, this is the wall of the orbital cavity: floor, roof, medial wall, lateral wall. The contents are the eyeball, eye muscles, nerves, vessels, fats, and others. The eye is covered by fascia, scalp, canal, fascia. The refractory media in the eye are the cornea, the lens, and the vitreous and the aqueous humors. The vitreous and aqueous humors.